Hello, I'm Dr. Neha Kapoor, Senior Consultant and Head at Asian Hospital, Faridabad in Neurology Department. And I'm here to talk to you about Alzheimer's disease. So what is Alzheimer's disease? Alzheimer's disease is basically a disease of neurology in which the patient complains that he's forgetting things. So the patient will complain that he's forgetting names, he's forgetting his daily routine activities that he does. He forgets where he's kept his belongings, he's forgetting his ways, the normal ways that he goes about in his, he may be forgetting his ways to the market, where the normal ways of his household are. Commonly, patient forgets the names of his family members and friends. Along with that, the patient may have disorientation to time, place or the person. He may get confused if it's the day or the night. Sometimes patients also have difficulty in remembering learned skilled motor activities, which is also called as apraxia in our neurological terms. So apraxia is basically a patient already knows how to do a particular task, which may be like cooking or maybe something like doing a skilled activity, and suddenly he starts committing mistakes in doing that. It could be a simple activity like wearing clothes or taking a bath or eating your food. So suddenly the patient will have difficulty in wearing his shirt or his trousers. So instead of putting his hand through the sleeve of the shirt, he starts putting it through the neck hole of the shirt. Or instead of bathing properly, he forgets how to hold the mug or how to put the water on himself through the mug. Commonly, if the patient is fond of cooking and we ask the relatives, is the patient cooking properly, they may complain that, oh, he leaves the gas on, or he does not switch the gas off, or the patient is not properly cooking and has forgotten how to do it. So these are common symptoms that the patient complain of, and so commonly we ask the caregivers, are the patient dependent upon them for these activities of daily routine, or like bathing, eating, clothing, and if so, then these are major signs of forgetfulness or Alzheimer's disease. Along with that, the patient may also have certain psychiatric manifestations, like patient may have low mood dementia, or patient may be agitated in the sense that patient may go into an aggressive mode or a hyper mode. Patient may start having hallucinations, patient may have sleep disturbances, patient may have loss of sleep, insomnia, or sometimes patient may have over sleepiness or hypersomnolence. So coming on the treatment part of Alzheimer's disease or dementia, there are certain medicines that are available for reducing the disease burden for the patient and reducing and slowing the disease process, so that the patient is more independent for his activities of daily living, so that this memory improves, and also so that the patient is basically integrated back to the society and becomes more independent for his functional and daily routine activities of life. Along with that, there are also certain medicines for which if the patient is having sleep problems, we can give him certain medicines to benefit from that point of view. And also if there are certain psychiatric problems associated, then there are certain antipsychotic medicines or certain antidepressants that can be given to the patient to control his mood disorders. If we talk about the age of onset of this disease, commonly, Alzheimer's disease is a disease of the elderly age group, commonly occurs after 60 years of disease, and after every 5 years that is added to the age, the incidence goes on to increase with the age. If the Alzheimer's disease occurs before the 60 years of onset of age, then it is classified as young onset Alzheimer's disease, and we think of genetic causes of Alzheimer's disease. And for diagnosis is basically a clinical diagnosis, and if we do an MRI brain or the imaging of the brain, we just see certain changes in the brain which denote the onset of Alzheimer's disease. Thank you.